Now, for more on this, I'm joined by Angelique Coetzee. She joins us now from Johannesburg, and she's a medical practitioner. And you were also the chair of the South Africa Medical Association during the first phase of the implementation of this bill. So phase two hasn't really happened yet, but give us a sense, what's the situation like now in hospitals today with regards to medical staff and resources and so forth?
Thank you. Good morning. So if you look at the funding model that NHI is actually, or the term NHI is referring to the funding model. It's not really referring to what services we are going to get. This is a funding model. So if you look at the current situation in South Africa, especially in the public sector, there are pockets of excellence, but unfortunately, we are sitting with a huge problem regarding human resources, infrastructure, also corruption, people working in posts that they're not suitable for. So there's a problem. And if we don't fix that problem, it's not going to help what amount of money you throw into the system. You need to start at base level and fix the inequalities at base level. It's not and it should not be a political exercise. It must be an exercise that is what is in the best interest of the community and the people of South Africa. And this is what we're currently not seeing. Yes, the private sector is better, but again, it can be better because the bar is so low in the public sector. So all is not well in the private sector as well. So we all agree that the country's healthcare system requires reform. But the NHI bill in its current form is not economically viable for South Africa. And I think that's the crux that we need to look at it. So it doesn't matter what everyone else is saying. If we don't have the right funds available, and for now, it is important to understand that the government had not made any workable documents available of where they have looked at what is needed. There is no blueprint in the sense of what services are we going to give.
So Angelique, let me just ask you then, so what is needed? I mean, on the one hand, you're saying that the NHI is a funding model, but it's not really a question about money. I mean, if I understand you correctly. So what's needed to get this high quality, high level medical care free for all?
So it is a funding problem. And that's why the national NHI is a fund. But there was no research done in what we need. So what we currently have is a bill that's out there that needs to be signed, but it's unclear, it's undefined, it's unknowable, as there's been no published attempt to a comprehensive costing from NHI as required by law. So if you look at what is currently happening and what is going to cost, they say that the old estimated cost was 200 billion, and that was a conservative estimation. So the newer estimation is that it's going to cost around about 600 billion a year. But the government itself has already confirmed that your taxpayers would be footing the bill for the scheme. Now, to raise in the conservative 2 billion rand, what was conservatively first of all said, that is, it would seem that in South Africa we would either need to increase our VAT from 15% to 21%, or income tax by 31%, or a payroll tax on everyone for around about 1,500 rand per month. So this is not in South Africa our macroeconomic realities, that we have a slow economic growth, we have a very, very high unemployment rate, we have diminishing take-home pay, low levels of business and consumer confidence, and a declining tax basis. So how are they going to fit or to foot the bill for what we don't know? We don't know what the NHI is going to cover, and this is well known.
Okay,
so,
Angelique,
yes,
just let me jump in here, please. I mean, one thing is the funding, but also we're talking about the high level of medical care being offered to patients. I mean, in this package, we heard about medical practitioners leaving South Africa. What do you need to make their working conditions better so that they stay and can actually provide this high-level care for people?
So it's a multiple factors in South Africa currently. And I think the NHI is just the cherry on top of the cake. So doctors will leave and healthcare professionals will leave the country because of the unknown of the NHI. We don't know. The second thing is, if they look at the high crime rate, the high unemployment rate, the schools in South Africa, the electricity cutouts that we have, if you take everything into context, then to have an NHI on top of it all, I would rather then go, if I'm young, to another country, which I know that I will work under a type of NHI, but it's already been sorted. More or less, I know what I get. And I then get a very stable economic environment where I know my children is safe, where I know there's electricity, where I know there's no potholes in the road. You know, it's a whole thing. It's not just NHI that will lead to people going. If it was just NHI, we could have put a lot of pressure on that, but it's much broader than that, what is currently happening. So you need to make the economy grow, you need to take crime away, you need to get electricity going or railroads going. So it's more complicated than only NHI, why people will be leaving.
All right, that sounds like a big project for you guys to work on going forward. Angelique Coetzee joining us live from Johannesburg. Thank you so much for your time here on TRT World.
Thank you so much.